Well, hello everyone. My name is Gleb Masaltsev, and today we'll be presenting my culminating project, which is global data on the prevalence of diabetes in minors. And it was performed in Russia, where I currently work. So I'd like to start with saying a little bit of some thanks. First of all, to the Erisman Federal Scientific Center for Hygiene and Dr. Ludmila Sarkopil, who was my practicum supervisor, and also to the School of Public Health and Social Policy and Dr. Nigel Livingston. Pardon me, sir. Thank you. Thanks a lot for your support. So going forwards, I did my practicum back at Russia, and first of all, I'd like to go over some background in order to kind of get into the whole research question. So diabetes mellitus, as I'm sure you all know, it's a metabolic disorder of multiple etiology, and it's considered one of the 4 priority non-communicable diseases in the world by the World Health Organization. And as of today, 4 primarily types of diabetes mellitus are recognized. It's type 1 diabetes, which is also known as the juvenile onset diabetes, and type 2 diabetes, it's the most common one, diabetes in adults. There's also gestational diabetes, which sometimes happens in women who are pregnant. And there's also a number of 2 prediabetic states, impaired glucose tolerance and impaired fasting glycemia, which mark the continuum from normal health to diabetes. And for this purpose of this review, I would focus mostly on the type 2 diabetes because it's more common in adults. And also another important syndrome is the metabolic syndrome, which is also called the insulin resistance syndrome. And it's a very hard thing it's essentially to kind of get your head around at first when you see this, but it's a cluster of symptoms, including hypertension, upper body obesity, and dyslipidemia, with and without hyperglycemia. And importantly, people with metabolic syndrome are at very high risk of developing diabetes, second type diabetes, type 2 in the future. And they're common. Sometimes metabolic syndrome is also associated with the impaired glucose tolerance in prediabetes. And their common etiological factor for all the symptoms within the syndrome and also the type 2 diabetes and impaired glucose tolerance is the insulin resistance. And in normal people, insulin resistance is a mechanism which is very helpful for survival and helps during times of crisis. It helps the brain to get more energy, more glucose by making the tissues resistant to insulin, so that the majority of the glucose goes into the brain, so the brain can actually think of a way to get out of the crisis. But in pathological states or of constant stress, that sometimes can lead to metabolic syndrome and further to type 2 diabetes. So in the Russian Federation, type 2 diabetes is actually considered a very serious problem. As you can see, the prevalence of it actually increased twofold since 2000, from 2000 to 2015. And as of right now, the prevalence of diabetes in Russia is approximately 9.3%, so estimated by the World Health Organization. So who are miners? For this purpose of this review, miners is a number of professions of people who are engaged in extracting ore or other mineral natural environments. For this purpose of this review, I'm not speaking about smelting or refining or other production or processing of ore. So the Russian mining industry, the mining occupation is actually recognized as a hazardous occupation in the Russian Federation. It's governed by a number of laws, but namely the purpose of these laws is to prevent anyone from before the age of 18 of working as a miner, and also upon hiring and every year afterwards, every person working in this occupation has to actually go through an extensive medical examination. It's actually a complete exam to make sure that nobody there's no pathology or no hidden pathology which can prevent a person from doing their job or that can compromise their health significantly. And an important note is that most mining companies in Russia are currently privately owned. So the reason why I embarked on this research, so my question here was, because mining is such a demanding occupation and it's very hazardous, is there a chance that this whole stress that the miners go through actually puts them at a greater risk of diabetes and prediabetes, possibly? The reason why I even thought of that was because the Rospotrebnadzor, the federal agency which I work for, they actually do, they're tasked with looking over the population, posting epidemiological data on the population, health population of the Russian Federation. And they actually have a section on occupational pathology, and the way that they go about is they just post the data for the economic sector of research extraction, which the miners are included in. And they actually showed that this sector particularly has the greatest prevalence of occupational pathology, and the majority of the pathology comes from physical factors such as noise, vibration, and so yeah, once again, so the research, so in order to answer the question whether being a miner can increase your chance of getting a type 2 diabetes or maybe puts you at risk of having type 2 diabetes, I decided to do a literature review So in my literature search, I searched three databases: the library.ru, which is the Russian citation index. It's a Russian analog to Scopus, if you're familiar, by Elsevier. Science Direct by Elsevier, and also the PubMed, which is the Medline, for the relevance to this project. I also included 6 reports from the gray literature, 5 from the Rospotrebnadzor for the past 5 years, and also 1 from the WHO on the Global Report on Diabetes. The literature that I searched for was from 2013 up to this date, so the last 5 years. And I ended up with 18 unique articles, and they were later scored on the Oxford Center of Evidence-Based Medicine 2011 scale for likely best evidence. And half of the articles were cohort studies. There was one literature review, and the rest were cross-sectional studies. Because I can't present everything that I've did in the research here, I'm going to focus on the most important cohort studies that I was able to get from the literature. So a lot of evidence comes from JINCHANG industry cohort in China, which was a large-scale investigation of a large nickel production company. They especially set out the cohort study in order to investigate how occupational exposure to metals affects health. So they separated all their participants in 3 categories based on the amount of occupational exposure to metals. And they've actually found that in the sample, the prevalence of diabetes was in line with the average prevalence according to WHO, despite having smelting refining workers and mining production workers having a really big exposure to metals. However, even though no significant association was found for risk of prediabetes in the study, still an elevated risk for type 2 diabetes was observed for both male and female workers in the mining, production, and smelting refining occupational groups in relation to office workers. So despite not being significantly different from the national average, the workers in the exposure groups still differ from the reference group based on the, in terms of occupational exposure and based on elevated risk of type 2 diabetes. And the follow-up studies examined this association, found that it's moderated by factors related to lifestyle, such as smoking and alcohol consumption, so people who smoked actually had it worse. And also they did one study on female reproductive risk factors, and they found that it's also influenced this association. So a number of, actually 2 studies came from the post-Soviet region, and one was in Belarus, and they've actually found that the insulin people who work underground and above ground miners actually show greater insulin resistance than the reference group. So there is a chance that they have a greater metabolic syndrome, prevalence of metabolic syndrome as well, which can put them at risk of type 2 diabetes. And a very unique study made in Russia by actually some of my colleagues at the center where I work for, Kirikov and Lapko, they've actually surprisingly found a prevalence of diabetes much higher than the national average for Russia. But that's a very unique finding as well. There was another cohort study at Papua, Indonesia, copper study, and they found that the longer people worked in the mining industry, the greater their chance, essentially, the fasting glycemia, the rate of persistent raised glucose increased the longer they were engaged in the occupation, suggesting that the longer you work as a miner, the greater your chance, perhaps, of getting a type 2 diabetes, or at least insulin resistance. And a follow-up study also showed that in the cohort, the prevalence was on the level of national average. So for my conclusions here, overall the literature suggests that the Russian miners are likely to be at risk for type 2 diabetes because research demonstrates that occupational metal exposure can actually increase your risk of getting the disease. And possibly there's also association between perifasting glycemia and dysglycemia. And also, so this association is likely brought by the frequent activation of the normal biological response of insulin resistance, which I talked about previously, which is caused by the constant stress that the miners are subjected to. And the metabolic syndrome is also expected to be more common in miners with longer duration of employment. And most likely the prevalence of diabetes is usually at or below the national average. So this brings us to the limitations. So there were a couple of limitations in my study. The first one was the library had a very poor coding. Also, a healthy worker effect definitely was a factor in the studies that I found, coming back to the national average. And also, there was also a lack of accountability between different type of miners. You know, some people who does uranium mining, definitely have a very different exposure for someone who does coal mining. And also some studies were cross-sectional studies can also affect the results. So the implications for public health practice here, I would say that there exists a need to allocate greater resources to monitoring the national prevalence of the metabolic syndrome and the demonic occupations of Russia, because it may be indicative of the type 2 diabetes. And apparently my time is up, so I'm just gonna finish this one line and say, I would say that the economic sources of resource extraction group should have subgroups in order to account for the differences in all the minors. So that's it. Thank you very much. If you have any questions, I'd like to answer them.
Thank you very much. Any questions? No.
Thank you, Gleb. That was a lot of information and really, really interesting. I have a partner who works in mining and has spent time in Russia, so this is really interesting. But what I'm not sure if I'm clear on is what's the cause, really? Is it exposure to metal and stress? And does it have anything to do with our diet? Does that come up a lot in literature? Because I just spending some time in a mining camp in North, which I have, their diet is something else. Like they'd eat a lot, from what I saw. So does that come up at all, or is it really some sort of causality between exposure to metal and stress?
That's a good question. Despite the fact that, and thank you for making this question, despite the fact that the cohort studies are supposed to be very good at picking up causal relationships, for the purpose of this cohort studies that I found, usually there's just an association. So the study, they just measure urinary, percentage of metal, and then they see they measure some of the biological factors or like the indicators, and then they say, hey, this group, they have this number of exposure to metals. Is it this common? The average urinary metal exposure is this and this concentration, and hence the prevalence of of insulin resistance is this and this. So in a sense, the causal relationship, I can't pronounce that. Causal relationship, yeah. It's not very well established. So there's only association that has been established between, in terms of the occupational metal exposure and those effects. You can't really say that it's what is causing it per se. But it's a very strong argument for the association, but it's not a causal effect. In terms of, as you say, that they eat a lot in terms of like dietary intake, for the JINCHANG industry cohort, they found that people who definitely, for one thing, being overweight is very much a risk factor for diabetes, but usually that is not the case for the minors because they usually are in very good shape because they exercise a lot. But in terms of food, that's what I thought, because the food, in terms of the nutrition, it has never been done. Nobody really looks at what they eat and how that influences them. All that is done is somebody would just go into the lab, measure the height and weight of a person and say, hey, you have a normal BMI, body mass index, and you have this and that, and then they make conclusions based on that. Because this study that was done in Russia by Kirikov and Lapko, when they had this huge elevation of prevalence for diabetes in these Russian miners in 2 quarries, it could have been that those people were just having a lot of carbohydrates. Maybe they had a lot of vodka. Who knows, right? Maybe that's the case why they have such a huge elevation. Nobody even speaks of it. Just like, hey, we moved in, we screened those people, and they have a huge elevation. So in terms of nutrition, that'd be very good. It would be very interesting to look at that. I know there are some studies out there. Unfortunately, for this review, they didn't particularly dealt with the diabetes. So if there were studies on nutrition per se, and there was nothing about diabetes in there, I did not include that. So I'm not sure. I know there are works out there, but in terms of diabetes and mining, it's not out there. So the research is not there.
Thank you. That was an excellent answer.
Well, thank you very much.
You're very knowledgeable on the topic. It's really impressive. So thank you. I think we're out of time for this one.